Hi moms and dads, a very warm welcome to another episode of Today's Parent. I'm your host, Christine Kasina. Our topic today is about cancer. Cancer has affected us in one way or another. Even if you're not directly affected, all of us are indirectly affected in one way or another. So our topic for today is a focus on cancer, especially when it comes to, cancer and children, and providing support when it comes to caregivers. So our topic for today is just empowering us on matters children and cancer and caregivers and cancer as well. In studio today, we have a very important guest. His name is Philip Ouma from Faraja Cancer Center, who's going to empower us on matters cancer. Let's see what we can learn from him. Mr. Ouma,
yes,
what a pleasure to have you.
Thank you.
Is it true, or we are imagining, or because we see it so much in the media, that the cases of cancer have risen? Do statistics support the same?
The statistics support the same, but on the other hand, I also want to say we don't have very clear statistics, okay, in the country, because we've never done a nationwide cancer survey in the whole country, but we are seeing rising cases of cancer.
Okay.
Yes.
Okay.
Yeah.
I'm wondering which is the main, among the cancers, what's the main one that you're seeing that's having like a surge?
Of course, it depends with the age group that you're talking about. So if it's adult cancers, of course, it's the classical breast cancer, mostly among the women. And then we have prostate cancer among the men. And what is interesting is the latest statistics that was released shows that cancer of the esophagus has increased more among the men. It's mostly among the men.
I wonder, why is that so?
We don't know why, and I think it's a good area that, those who are doing research need to focus on in the next few years.
Okay.
Yeah, and then, of course, when you're looking at childhood cancers, we have a lot of cases of course, lymphomas have increased. We have cases of nephroblastoma, most of the common childhood cancers.
Okay.
Yes, but there's an increase. We can say there's an increase.
So lymphoma is what? Cancer of the blood?
Yes, cancer of the blood.
And the other one you mentioned is?
Is nephroblastoma.
Which one is that?
Yes, it's cancer of the liver.
Of the liver?
Sorry, not liver, kidney. Sorry.
Of the kidney?
Yeah, of the kidney.
I've never
heard
heard
of that one. And then, of course,
one.
we also have brain tumors.
That one I've seen, especially at Kenyatta.
Yes, and then we have retinoblastoma, which is mostly cancer of the eye. Yes, when you go to Kenyatta, we have a ward that is set up for that.
Okay.
Yes.
I know you've worked with Faraja for a very, very long time.
Yes.
Just briefly, what exactly do you do at Faraja Cancer Center? What is it about?
Faraja is a non-profit organization that basically offers complementary, or what we call supportive therapies for cancer patients and their caregivers. Yeah, so we have different programs that anyone who is being treated anywhere, whether it's at Kenyatta or whether it's Nairobi Hospital or Aga Khan, you can come to the center in Nairobi and Eldoret and get support, whether it's in terms of nutritional therapy, counseling services, we have exercises, we have other programs that are also geared towards the kids, like the Craft for Cure, which we do at Kenyatta every Friday and Wednesday.
Right.
Yeah.
I understand that there's a very special term when it comes to, caregivers and just the psychosocial support around cancer. It's called physio-oncology or psycho-oncology?
Psycho-oncology, yes. Psycho-oncology.
Psycho-oncology.
Yes, so it's the psychological care for the oncological cancers or malignancies.
Okay.
Yes, yeah.
All right.
Yeah.
So focusing on the support you offer children especially, how does that go?
So we have different programs for kids. The most common one that we have at Faraja is the Craft for Cure program.
Craft for Cure.
For Cure program and music therapy program at Kenyatta National Hospital. Why do we go to Kenyatta? Because that's where we have a lot of kids with cancer. The others are at Gertrude's and of course Aga Khan. So when we go there every Wednesday, we have a team that goes there and does music therapy. So just spending time with the kids, dancing and singing to help them distract themselves from the pain and the experience that they are going through. And then every Friday we go there with a team. We have a team of dedicated volunteers. In all the wards, we see around 400 kids every Friday at Kenyatta.
That's a lot of children, which is
good. Yes. So we go to different wards and we have a specific art program. So it's therapeutic art. It's not just drawing, nakuchora, it's therapeutic art. We focus on, let's say, this Friday we are going to focus on the body and we'll draw the body, the kids will draw the body, and we'll use that drawing to kind of like elicit conversation with them, find out in this body, where is it paining, how is the body structure like. So you use their art to form out, to have a way of eliciting conversation from them.
Right.
Yeah.
Philip, when a child is so young and all these changes are happening in their body,
Yeah.
cancer is not something that we take lightly.
Yeah.
How do we help children cope?
Yeah.
How can we do that, especially you as a professional? What does your platform do to help children cope?
Well, that's a big question because one of the things that we find with the kids, whether they are kids who have cancer or kids who are sick in any disease, the kids are very good. They are very resilient. Okay, so when you go to Kenyatta, for example, you'll find a child crying because they have gone through chemo or they're going to do an injection. And then 2 minutes later, you will see them running and jumping, and then you're like, hey, is this the child who was crying? So the kids are very resilient, and what we do basically is to tap on that resiliency and have these specific programs that we can be able to help them with. But besides that, we have in our art therapy, it's specific. So there's a day that we also use drama therapy. We're even adding more drama therapy. We have storytelling. But what we are using with that is to try and also educate them, not just for entertainment, but also for education. So we go there every Friday and educate the kids. Like, for example, when you have chemo, what are the things to expect? Okay, when you're going for surgery, what do you expect? Okay, our program is still in its infancy. When you go to the developed nations, for example, I had an opportunity to attend a meeting in the US where they have everything is so structured and organized. Before a child goes for surgery, for example, they'll have to see what we call a child life therapist. Okay?
Just to be prepared.
To be prepared. And they have a dummy child. Yeah? The dummy child they'll be told, this is what we are going to do with the chemotherapy, this is where we'll put the infusion, and this is what we are going to do. So it's like preparing the child, they are able to see. And then that also kind of like destigmatizes the operation. We are not there yet, but we will get there.
I hope we get there.
We will. And in Kenya, I think it's getting there. When you go to MTRH in Eldoret, they have a very amazing child life program, and they do this kind of stuff.
Do you think a child understands what cancer is? Or they know they are sick? That is where it ends.
That's a good question, because depending on the age of the child, yeah? So, because when you talk about a child, there are those who are, who are young, like 1 year. Some of those will not be able to understand. But then when you're looking at the child's developmental stage, there are those who are maybe what we call higher. Those are adolescents and young adults. They'll be able to understand what kind of cancer they are going through.
For sure.
But of course, so it depends with the age. But majority of the kids that we see at the hospital, even those who are older, they don't have detailed knowledge of the diagnosis. So they'll say naumwa na tumbo huku, ama kichwa inauma, ama niko na uchungu hapa, but they do not know the real disease,
Okay.
Yeah.
In the same breath of psycho-oncology and how it's about providing support, moral support, emotional support.
Yeah.
What kind of support do you offer to other members of the family, especially, the father, the mother, the caregivers within that setting? What kind of support is normally provided?
I think that's a very good question and very important, because you realize when an adult has cancer, it's really stressful, okay? But adults can be able to talk about how they feel, and things like that. But when you have a child who cannot be able to vocalize how they feel, the way they vocalize is through crying.
Yeah.
And sometimes you don't know what the pain they are facing. So it can be very stressful. So you find most of the parents who have kids with cancer are more stressed. So what we do at Faraja and at Kenyatta, for Kenyatta we have a parent support group. Okay?
So in Kenyatta you have a parent support group?
Yeah, so support group for parents who have kids in the hospital. And they meet every Friday. When you go to every Friday on level 3 at 10 to 12.
So every Friday level 3 at 10?
10 to 12.
10 to 12, 2 hours.
Yeah, 2 hours of support group meeting. And it's a support group that is also, we are intentional about it. Number one is to deal with the distress that most of these parents are facing. And then number two is also to educate them about care for the kids, and also to have an understanding of the disease. Because when you go to Kenyatta, for example, that's where we work a lot with the kids, You find parents come from wherever. People come from Turkana.
Yeah.
They come from Kisii.
Oh, the kids are from all
yes,
over.
Yes, and then you
Kids
tell
are
them
from
your
everywhere.
child has retinoblastoma, or your child has, lymphoma, or, so they don't understand what is that monster. So you have to break it down to them so that they understand what the disease is about. That's number one. So we educate them. Then number two, some of them have a lot of issues, because you find like when you bring your child to Kenyatta, you don't know how long you're going to stay. Most of them usually don't know. And then you come here and, maybe it's the mother. You have 7 kids you've left at home, normal, or 5, okay? So you go to Kenyatta, and then what happens? You're told you have to stay here for 3 months. And
Can you
did not
imagine?
plan. Yes.
You have the family to run. You have 7 other kids at home.
7 other kids and a husband.
You need to
probably
work.
Who is a drunkard, So you have to
Very
manage the
unfortunate.
home from the hospital. So what happens? You find that this mother is really distressed, okay? You have a sick child, you have a husband at home, and then you have kids at home.
Yeah.
And the kids need to go to school, life need to continue. So we deal with this issue. We have one-on-one sessions with
that's
the parents,
wonderful.
yeah, so that we're able to address this.
In terms of results from out of these sessions, what are the expected outcomes when you have those sessions with the parents? Do you feel, or some of them come to you and tell you this has been so helpful, thank you?
Yeah.
It's been, I'm sure it's been working.
Yeah, I think it's working. Now, what you're asking me is physical. Do we have results? In fact, one of the things we're working on is to do a study, because you need to have a study. So next time when I come here, I will tell you when we saw this parent, the distress level was
When
9.
this level end?
Yes. Then after having consecutive sessions, because they're there for 3 months, the distress
Has
level
gone down to this
has
level,
gone down
or
to this, yeah. But sometimes the distress are not caused by the child or the home, but the institution. Okay.
In what sense?
Institutional issues. So for example, I've had cases of parents who complain about how they are handled by some of the medical team, the
Right.
nurses, and not all the nurses.
Yes, of
Some of
course.
the nurses
We have
are
some who are
really
angels.
amazing, but some of them have been mishandled. So this also increases their distress level. So in such cases, we try to, kind of like talk with the management or with the institution and
Yeah.
say, hey, there's this thing that is going on. Let's try and see how we can work it out.
All right.
Yes, yeah.
Philip, let's take a break, and then when you come back, we can continue the conversation.
Thank you.
Our topic for today is about cancer, especially cancer support for caregivers and children as well. In studio today, we have Philip Ouma, who is from Faraja Cancer Center and is the patient support manager and is very knowledgeable when it comes to matters caregiving. He can share tips with us on how we can, just cope and see how to thrive as a family during this difficult time. We're going to take a short break. We'll be back right after this. Welcome back to today's episode of Today's Parent, where we are talking about cancer support. We've talked about children, we've talked about caregivers, and Mr. Ouma is going to share with us as we continue with our conversation. Philip,
Yes.
Cancer, it's just a sad topic. Have we reached a level where we can say we have destigmatized cancer?
That's a good question. Have we reached that level of destigmatizing cancer? I don't think we are there yet, but I can say we've made major strides compared to other African countries, because I'm involved in an association that brings in different countries in Africa. I think Kenya is far much ahead compared to our neighbors.
That's good to know.
Yeah, but we've not reached that level. I think government has really tried. The NHIF has been very, very helpful
Okay.
In ensuring that the patients get access to the treatment. So we are somewhere, but not to the level where we can say we've destigmatized cancer.
Yeah.
Mostly in the rural areas also. Yeah.
Okay. I want to pick a point from something you mentioned before we went on the break.
Yeah.
That when it comes to caregiving, a lot of the people who are caregivers, just assuming, I think most of them are the mothers, are women.
Yes.
Is that the case?
Yeah, that's the case.
That's
Most
the
of the
case.
caregivers are women. Yeah. Yes.
Okay. So this one person you mentioned has children at home.
Yes.
She needs to run the home. 3 months she's in
Yes.
the hospital.
Yeah.
What support or what tips can you share with a mom who's watching, a woman who's watching, who's literally falling apart
Yeah.
on how she can just have a hold on things during that time,
things,
and
yeah.
even on herself as well?
Okay. It's very important. Like you mentioned, most of the caregivers are women. You know, women are just nurturing. They are nurturers. One of the things that I can say is whether it's you're taking care of a child or a family member, is as you take care of that person, one of the things that I advise people is organize so that you have, you know, like a schedule. You have time for yourself.
Okay.
So, for example, if you're the one who is dropping the patient to the hospital, please find out if you have friends around. And one of the friends, you can say, today I'm resting, let the friend take care. Or if you have family, sometimes you have families, so the mother can invite a sister, or if it's a wife, you can have someone else who can also divide, you know, we divide the roles. Very, very important.
So enlist help.
Enlist help. You have to enlist help. I know there are people who struggle asking for help, but it's very important. That's number one.
Yeah.
Number two, it's very important for you also to make sure that life continues, mostly when you have kids, okay? So for example, if you realize, if you have a child who has cancer, the focus sometimes is on this one child. And then, of course, we don't take care of others.
Of the other children.
So try to find a way how you can spread your love and care also for the other family members.
That's a good point.
Yeah. And then another one is there are some organizations like Faraja that have started caregivers support groups. So if there's anywhere you are, go and get support group, whether it's in Eldoret, wherever you are, connect to a support group, because it will give you an opportunity to share about some of the challenges that you face, because caregivers also face challenges. As you take care of the patient, you'll face challenges.
You know, Philip, now that we've mentioned the part of the challenges that caregivers face, you meet them on a daily basis. I know you deal with the patients, but then you have the aspect of the caregivers. What challenges do they face?
Those are many. People have, of course, it depends also with the dynamic that you had before cancer. Let's say if it's a husband-wife relationship, there are dynamics that were there before. If your marriage was good, then it makes it a bit manageable. If your husband and you had difficult time, or you made your wife's life difficult, the caregiving might also be challenging. I've come across patients who are actually alone.
Because that is sad.
It is sad, but they are there. But the challenges that they face, of course, like I said, it depends with your previous relationship. If you had a good marriage, then I think it will help. The other challenge that they face is you find that sometimes when it comes to eating, mostly when they go through chemotherapy and so forth, the patients, sometimes they don't feel like eating, because they feel like, I don't feel like eating, my body is just, you know. But the caregiver, because they care and they love this person, they really want them to eat, and the doctor will push them and say, you know, for before you come for your next chemo, I want you to add some kilos, you know. So what happens is there's that fight between the caregiver and the patient. The patient doesn't feel like eating, but the caregiver feels like, no, you have to eat. Okay, so that brings in, that's the commonest tussle that I find with these people. And then, of course, sometimes we have cases whereby there are family issues, you know. There are things to do with properties and things like that. Stuff needs to be put in order.
We are already planning for this person.
Yes. There are times when the family members, and it's not just the caregiver, the primary caregiver, but you have people surrounding, like the extended family. They are already thinking of the land, the properties, because they know this person is dying.
That's it.
And it's not always the case.
Finances, apart from the medicine part of it. When it comes to something like nutrition, do cancer patients have a different kind of diet?
They depends, of course, with the type of cancer that you have, because there are some cancers whereby we need to make sure that you really have a diet that is more on maybe some of the nutritional components. I'm not a nutritionist, but I know that they need to have a well-balanced diet. That's what I will advise. If they are on chemotherapy, they need to eat whatever they can. As much as they can, because we really want to make sure that their body is strong to be able to take
to handle the medicine.
To handle the medicine. So
Faraja Center, what you do with your cancer support? Because finances is such a big issue, and I know it's the one primary thing that when people come into your platform, they're then wondering, are we going to get any financial help? Are there any sponsors you get? Then you share some of this with the patients. How does that work?
Yeah, we have a medical fund. It's called it's a Faraja Medical Fund.
Oh, you do?
Yes, we have a medical fund. You know, it's we've been raising money. We wanted to raise 100 million. And then from that,
Wow.
of course, you're able to get some interests that will allow us at least to support patients for the next number of years. So that is in place. So anyone who, of course, has a patient who is struggling financially, they can always come to the center. We have forms that they will have to fill. Once they filled in the forms, there's a committee that is independent that will verify, look at the forms,
Yeah.
make a decision, and then, of course, they'll be told whether we will be able to support them or not.
I wonder how you qualify.
The qualification, of course, we are looking at somebody who is financially, who is really needy, because we have others who might have other sources of support. So somebody who doesn't have really a source of support, like you're the last resort for them. I've had people coming, to the center, and they say they are not needy, and then when we do background check, you realize they have other members who can support them. Kenyans, the way we are. But we're also looking at the age. Of course, I know some people will say that, but why, I have a grandmother who is 100, they are as more important to me than that person who is, like that person who is 20 or whatever. We have to look at age because we have limited resources, and we are looking at also productivity. We know that this person really means to the family member, but we also have to look at the others. We have young children, sometimes we have younger mothers, so we give them priority.
Or like you have a 34-year-old case and a 98-year-old
who will
case.
you be able to support?
That's a tough decision.
Yes,
That's a tough. Of course, all human lives matter, but that's a tough decision.
That's
a tough decision.
Those are some of the things we look at.
All right.
Yes.
As a country, what do you think we can do better when it comes to cancer support? And a country is about the people. As a people, what can we do better?
I can say two things. We have those who have been diagnosed with cancer, and then we have you and me who have not been diagnosed with cancer, and we hope that doesn't happen. So for those who have been diagnosed, it's very important for us that we give them that support that they need. Having been in the cancer field for over 10 years, cancer diagnosis is not easy. It's a tough journey. And what these people need support. They need for us to hold their hands and give them hope and courage. Even when the situation looks like they are in their last stages, they still need that hope that they can hang on. So let's be able to give them that hope, okay? That's what I can say. And then, of course, the government has really done well with the NHIF. I don't hold forth for the government, but I have seen the changes because I work with people, and I've seen the changes that have happened. So the government can continue with that. I think it's something that we need to encourage for them to continue, not to make changes the way they were trying to make the other day. I'm happy the president, say that's not in action. So it's important for them to continue with the NHIF coverage, and I hope that they can even cover more, And then for individuals, there's issue about risk factors. It's very important for us. We need to have healthy lifestyle. It needs to be something that is within our lifestyle. Exercising, eating healthy, watching your habits, eating habits, exercising habits, make it your lifestyle. I think that's what I can say.
So, Philip, what is your parting shot to our viewers?
My parting shot is everyone needs to, the ladies need to go for screening. This is January. It's cervical cancer month.
That's good to know.
So it's very important for you to go and get screened. And those who have kids who are 10, girls, mostly girls, the government is giving out free vaccination. They are rolling it out. I think this week they are in Makueni at Wote. In fact, today there's actually a free screening going on. So it's important for people to go. But also for the others, don't wait until, when it's breast cancer month or prostate cancer month. It's January. Go get your health check and be screened. Thank you.
Wonderful. How can somebody plug into your network, Faraja Cancer Center? If anybody wants to get in touch, plug in, come over, how do they do that?
Faraja, we have a website, www.farajacancersupport.org.
All right.
Yes.
Thank you, Mr. Oma.
Thank you very much.
All right.
Asante sana.
On that note, we come to the end of today's episode where we were talking about cancer support. I hope you found what Mr. Oma has shared to be very, very insightful. The one thing that we must do is go for screening. That is so important. Let us be proactive and do that. And for caregivers, there's also help for you. So reach out to Faraja Cancer Center and see how you can plug into the networks and get the psychosocial support that you need. I have been your host, Christine Kasina, and this has been today's Parent. And we've been here in studio at Little Cribs, where you come to when you're looking for kids furniture. For parenting resources, go to www.supermamas.co.ke. Thank you so much for your time. Have a wonderful day.